Good afternoon, everyone. My name is Leia Sardenia. Today, I will be I will do a demo about inserting a NGT tube. So before that, I will share a slide. So today I will be discussing the step-by-step NGT tube insertion. So what is my objective for this? To know the step in inserting the NGT. Second is to know the supplies and equipment. To know the indication, contraindication, and the implication in nasogastric intubation. So this nasogastric intubation is a procedure that you will insert the thin plastic tube into a nostril. So this is the nostril to the esophagus to stomach. And before that, we need to know the indication in inserting the nasogastric intubation. So we need to know the gastric decompression, aspiration of gastric fluid content, feeding and medication, then prevention of vomiting and aspiration. Once we say gastric decompression, the example of this is that you will connect it to a suction and the gastric content will be removed from the stomach. It's usually indicate if the patient have a stomach surgery or a intestine surgery. So the next one is the aspiration of gastric fluid. The example of this is the gastric lavage. For example, the patient have a poisoning and also a overdose medication. Usually, we are doing this. This is very common with pediatric patients who is playing the medication, especially at home. So the next one is the feeding and the medication. Usually, the older patient, they have difficulty in eating, they have a poor nutrition, and to have the proper and exact amount of nutrition, dosage of medication, we are using the NGT tube for giving the medication and the feeding. And the next one is the prevention of vomiting and aspiration. So for example, I have prepared already all the equipments. So this is all the equipment that we need for insertion the NGT. It is very important that you have the stethoscope and then the aseptic syringe, the lubricant gel, the tube, and then also the plaster, and you need to have a gloves. So before doing the procedure, you need to double check and read the doctor's order so that you will know and you will assess why the patient need the insertion of NGT, so that you will explain to the patient before doing the procedure. You need to explain why the patient need the NGT. And then also you need to assess if the patient by reading the doctor's order, you will know the age of the patient. So you will assess what size of tube we need to insert. Mostly if the patient is pediatrics, for the small pediatrics, we are using a French 5 NGT tube. And for the older children, we can use French 8. And for the adult, we can use French 16 or French 18. So before doing the procedure, for the safety of the patient, you need to identify the patient name. So check the ID band. So after you check the ID band, before doing any procedure, it is very important to know that if the patient is comfortable in doing it, if the patient agree, and also if it is safe for the patient. So for example, the patient is here already. For example, I am the patient. The procedure was explained to me why I need to have the NGT tube. So if the patient agree already for the procedure, you can position the patient in upright position. For example, I'm in the bed and I will be positioned in an upright position. So this is the upright position. So why we need to position the patient in upright position? For the safety of the patient, because the patient might aspirate or vomited while you are inserting the NGT. So the upright position is the most advisable position for the patient if the patient can do. And then the next one is before inserting the tube, know the contraindication. So usually, if the patient have a history, or you will assess the nostril. If there is any deformity, never insert the tube. If the patient have a trauma, facial trauma, never insert the tube. If the patient has a post-surgery, facial surgery, never insert the tube. So if everything is good to insert, so you can insert the tube. But before inserting the tube, you need to know how to measure while inserting the tube. So before, so in measuring the procedure, let us see here. For example, this is the first illustration. You need to measure. So before measuring, make sure that you have already washed your hands and then wear a gloves. So after wearing a gloves, then after explaining everything to the patient, and positioning the patient, you can now measure. So how to measure? So always remember while you are when you are inserting the tube in the patient, remember the acronym NEX. So NEX, N-E-X. Next stands for nose, earlobe, and then xiphoid process. For example, I am the patient, so I will measure the tube from the tip of the nose to the earlobe to my xiphoid process. So, for example, I have measured already. This, just put a mark here so that you will remember how much tube you will insert inside the stomach. For example, you will insert already the tube. So in inserting the tube, you can ask the patient to have a sip of water. So while you are inserting, the patient is in an upright position, just take it slowly and ask the patient to have a sip of water. But before that, you need to put a lubricant gel. So what is the simple step in using this one? Ask someone to put the lubricant gel here to be more comfortable for you. And then, usually, when you are putting the lubricant gel in the tube, it's about 4 to 8 inches of lubricant gel inside the tube. So you will put like that, and then you will insert it slowly. So why we need to put a lubricant gel? Most of the patient, when you check the nostril, it is very dry. So once you enter this tube, it will become more painful and irritable for the patient. So this lubricant gel will help the patient, will help to smoothly enter the tube inside the patient nostril. Then while you are doing the insertion, ask the patient to at least have a sip of water. So what is the rationale why you need to ask the patient to have a sip of water? So once the patient is sipping the water, the tube will be smoothly entered inside the stomach, and it will not, because sometimes if you will just insert right away very fast, it might go to the trachea and become more irritable. If you feel, another one to remember, if you feel that the patient is irritable, coughing already, immediately remove the tube. If the patient is change in color, like become cyanotic, immediately remove the tube. It means that you are not in the proper place. And then, for example, you have inserted already the tube. So how you will check if you are in a proper place? So before securing it with a plaster, try to check first. You need to use a stethoscope to listen. So while you are to listen, you will hear the sounds of the stomach in the stethoscope. If you hear that sound, it means that you are in. Second one, if there is a gastric content, it means you are in. Then second, and then the third one, you can also use a pH strip. So if the pH, for example, this is the pH strip, you will just put a gastric content of this. And then once the color was changed, once the pH strip was changed, it means that there is an acid already. It means that you are in. Or for the confirmation, you can do a X-ray to see if the tube is in proper place. Then after all, after you secure the tube inside the tube, make sure that the patient is comfortable. Ask if the patient is comfortable with the tube and secure it properly so that it will not be easily removed by the patient, because of most of the patient with NGT feeding with this NGT tube are those patients who are irritable, the older patient, which is not because there are some patients that is not cooperative, so you need to secure. So for example, on how to secure this one, for some it was like that. Then they will just, once it was inserted already, they will just put like this, then cover this one so that it will not be contaminated. And then plaster, use a plaster to the gown so that it will not be removed anywhere. And then after that, you need to clean the bedside, all the equipment that you have used already, and do a proper hand washing again. So that's all for the procedures of inserting of NGT. That's all. Thank you.